Hello friends, this is my new video and this time I chosen a topic that is some medical abbreviations. This video included some diagnostic terms, some diseases and many more. With their full forms, I will also tell you the uses and what they mean. So we will start. The first is ECG. ECG stands for electrocardiogram. This is the diagnostic test mainly used to measure waves of the heart. By this diagnostic test, we can find any disease or abnormality related to heart. Second is USG, stand for ultrasonography that we commonly use to call ultrasound. This is the diagnostic test or method we use to find out any structural abnormality in our body. As we all know, ultrasound is commonly used in case of pregnancy to monitor or to check up the structure of the baby inside the womb of the mother. Next is MRI, stands for medical resonance imaging. It is mainly used to look the organs and structure inside our body, and it is very useful in finding any brain or spinal cord disabilities. Next is CT scan. CT, C stand for computer or computed and T stand for tomography. This CT scan is a diagnostic method which is mainly used to diagnose or to find out any muscle or bone disorders. It can also be very useful to find the location of the tumor formed in our body or any infection in our body or any blood clot in any part of our body. Next is EEG, stand for electroencephalogram. This is also a diagnostic method which is used to detect any abnormalities in brain waves or to detect any electrical activity, disability or disorder in our brain. Next is CBC, stand for complete blood count. In this, we check up the component level or the component of bloods, is it normal or abnormal. It's also a diagnostic test. Next is LFT, stand for liver function test. As per name, it suggests that related to liver. So this is a test method or a diagnostic test which is done to check the level of liver components or the secretion, either they are normal or there is any disability or abnormality related to that. Next is KFT. KFT stand for kidney function test. As per name, kidney, that is related to kidney. This test include number of blood tests in which there is urea, creatinine and other components. Next is PFT, stands for pulmonary function test. This is mainly used to check the function of the lungs. It is mainly used before the surgeries or in the patient who are suffering from disease like asthma or any other lung diseases. Next is ABG, stands for arterial blood gas. This is an diagnostic procedure or test which is used to measure the level of O2, that is oxygen, and CO2, that is carbon dioxide, with the help of an artery or from an artery. This also helps to find that how well lungs are capable to move oxygen into the blood and how well they are capable to remove the CO2, that is carbon dioxide, from the blood. Next is TFT, stand for thyroid function test. In this, the level of thyroid secretions or the hormones which are secreted by thyroid gland is measured to examine the functioning of thyroid gland, that how well they are functioning and is there any abnormality related to that or not. Next is ICP, stand for intracranial pressure. This is the pressure exerted by fluid such as CSF inside the skull and on the brain tissue. Next is CSF, stand for cerebrospinal fluid. It is a clear or colorless fluid present in brain and spinal cord. It is mainly responsible to lubricate the spinal cord as well as the skull area where it present. Next is CPR, stands for cardiopulmonary resuscitation. It is the life-saving technique which is used to initiate the heart and the lungs movement. Next is BLS, stand for Basic Life Support. It is an care which is given to a person by the first responder or healthcare provider and the public safety professionals, which to a person who is suffering from any cardiac arrest or respiratory distress or an obstructed way. In short, we can say that it is a life support care given to the patient or the suffering person. Next is UTI, stand for urinary tract infection. This is an infection. As per name, it suggests that the infection caused in the urinary tract of a body. Urinary in simple, we can say that related to urine, means the parts or the tract which participating in the urine formation or secretion from the body. Next is SpO2. S stand for saturation, P for pulse, and O2 is none other than oxygen. This is the method to check that how much or the percent of O2 present in all over our body or the tissue of our body. Next is ET tube. ET commonly we are using in that ICU section. ET stand for endotracheal, means this is a tube which is fixed or inserted inside the trachea directly to provide the oxygen directly to the trachea of the suffering patient. Next is NG tube. N stand for naso, that is nose, and G stand for gastrial, that is stomach. This is a tube which is used to provide the stomach content or the food from the nose way, as the tube is inserted from the nose and it reaches to the gastric or the stomach, by which the food is provided directly to the stomach. This is mainly used in the patient who are unable to have food from their mouth directly. Next is NJ tube. N, that is naso, nose. J is jejunum or jejunal. This is the tube which is inserted same as NG tube, that is from nose, but it reached up to the jejunum directly. This tube is used in case of the patient or a person having any gastric or stomach surgery. Next is CPAP, stand for continuous positive airway pressure. It is a machine which is designed to make the airway open by providing mild air pressure. This is mainly used by the patient who are having problems such as sleep apnea, means while sleeping there is absence of breathing in them. So the doctor suggests to use this CPAP to make the airway open of these patients. Next is NPO, stand for nil per oral. This is the term which is used in the patient who are taking nothing from their mouth, means directly from mouth. This condition or these terms are used in the patient who are going for surgery. They keep their mouth nil per oral, means they are not taking any food from their mouth. And there are many other conditions also in which the patient suggested NPO. Next is AMBU, stand for Artificial Manual Breathing Unit. This is an artificial method, or we can say this is an equipment which is used to provide oxygen to the patient who are in emergency or while shifting in ambulance and many other emergency condition. We are using this AMBU bag to make the patient breathing rate proper and managed. Next is TT, stand for tetanus toxoid. It is a vaccine which is made to prevent people from tetanus. Next is BCG, stand for Bacilli calmate urine. It is also a vaccine which is given to prevent the occurrence of TB, that is tuberculosis. Next is MMR, stand for measles, mumps, rubella. It we can say that is a combo vaccine which is given to prevent the occurrence of three big diseases, that is measles, mumps and rubella. Then last is DPT, stand for diphtheria, pertussis, tetanus. It's also a vaccine which is given to prevent these three diseases.